He is a 72-year-old guy, and he's a passionate biker. And he used to go on long road trips on his heavy bike. So considering his heavy bike, so that fell on his knee, one of his knee, because of the fall, and that tore 3 of his major ligaments of his knee joint. So what we call as a multi-ligamentous injury. We all know we have only 4 major ligaments of the knee joint. Out of 4, 3 was majorly torn. So he was back on his feet without any support in 5th week, and on 12th week he was able to do a running and jogging, and by 4th to 5th week, you don't believe, he's back on his bike now. He's going on long road trips now.
This person, how soon after the injury did this person come to you for treatment?
He reached out to us around 5th or 6th day from the injury.
So let's say the person reaches out much later, let's say 5 months, 4 months have passed, the person has tried other forms of therapy or whatever.
Yes.
Would surgery still have been an option then?
No.
You are tuned in to Fever 104 FM with me, Shayan, on the Superhero Show. And on the show right now, it's time for Health Waves, courtesy Kaveri Hospital, Marathali. In the studio with me is one of my favorite doctors in the city of Bengaluru, Dr. Raghu Nagaraj. Thank you so much, sir, for once again taking time out and coming here.
Thank you, Shayan, and good evening. It's a wonderful evening out today.
Absolutely.
And yes, it's always my pleasure to come here and have a chat with you. Yeah.
Thank you so much, sir. You're the official doctor for the Superhero Show. Dr. Raghu Nagaraj, a little bit about you for people who might not be aware of you.
Yeah, I'm an orthopedic surgeon. I've been practicing from past 18 years in Bangalore. So I have worked as a senior consultant for 11 years at Hosmat Hospital and as a director of orthopedics at Fortis Hospital, Cunningham Road. And from past 1.5 years, I've been practicing as a director of orthopedics and robotic knee replacement at Kaveri Hospital, Marathali.
And, you know, couple of days before I start, we have a fascinating discussion to get into. But before we start that, I was reading on a leading newspaper, naam bata deta hu, Times of India, pe, that doctors are getting increasingly a little frustrated, and they probably get irritated because doctors are having less and less time in their day because their schedules are incredibly busy. And I have spoken to so many doctors from different hospitals, and I think you have the busiest schedule of them all.
Yes, even I read that article. It's about the burnout in doctors.
This
thing, right? Yes, I read that. Yes, see, what happens is, what I have seen is, see, every doctor is very passionate about his subject, and each doctor wants to work as much as possible because they get good happiness and pleasure out of the practice.
Right.
But what most forget is to take care of themselves. They stop taking care of themselves, like not doing good exercises, not inculcating some good habits in their lifestyle, like trekking or catching up with friends. So these things should not be stopped doing it. So like how you were in college, like how you were catching up with friends, the same way you should keep doing it. So right now, the way my lifestyle is, although I have a very hectic life, the working style, I start at 6 o'clock in the morning, I end up at 10 o'clock. But in between, I find a lot of time, like, I find at least 45 minutes for myself to do a good workout. And we'll make sure that in 3 weeks or at least once in a month, I try to catch up with my school friends. I try to catch up with my undergraduate friends, and we go for a trek on and off. So all these things definitely keep yourself from getting burnout. Yeah. So one should not forget to take care of themselves. They should develop all these habits.
Speaking of which, I read it again in the newspaper. This is a fascinating case of a person that you had operated upon. He was a 72-year-old man, and he's a very passionate biker who had a nasty fall and had ligament injuries due to the fall. And today, what I read in the newspaper was the person is back on his bike.
It's one of my interesting cases in my career because there is a lot of highlights into this case. He is a 72-year-old guy, and he's a passionate biker. He is a doctor and is basically a microbiologist by himself.
Okay.
And he used to go on long road trips on his heavy bikes. It's not just a simple bikes. He rides heavy bikes like Royal Enfield and the other big ones. So he had a good fall from his bike. So considering his heavy bike, you can imagine how much weight it would be. It would be minimum at least 40 to 50 kg weight, more than that in fact. So that fell on his knee. one of his knee because of the fall. And that tore 3 of his major ligaments of his knee joint. So what we call as a multi-ligamentous injury. So whenever we talk about multi-ligamentous injury of the knee joint, we all know that it always has to be a high energy trauma, like a fall of heavy weight on the knee or a proper road traffic accident. So this was one such high energy trauma, that too in a 72-year-old guy and was a passionate biker. So this was the case scenario. A 72-year-old guy met with a road traffic accident due to heavy bike, and that resulted in tearing of his 3 major ligaments. We all know we have only 4 major ligaments of the knee joint, front, back, and 2 sides.
Right.
Of course, we have corners also, but in gross we have 4 major ligaments. Out of 4, 3 was majorly torn. So that was the case.
It's
scenario.
a very challenging case. I can just listen to it and understand. So most people, when they think of ligament injury, and at that age for that matter, they think of wheelchairs and not comeback stories. That's the common consensus. So what gave you the confidence to take this case on?
Yes, yes, you're absolutely right, Shayan, because even from the doctor's point of view also, the moment the patient has crossed 55, 60 years of age, we always brand them as an arthritic knee, right? So whenever there is a ligament tear in aged patient, we always think that the outcomes may not be good, because even the literature to a certain extent supports that. But yes, literature also supports that if the knee is good, that means there is no sign of arthritis, and if the patient is having an active lifestyle, because see, not every 70-year-old is an active guy, but this was one among them. He's an active biker and he wanted to go back to his biking. That's one point. And his knee was pristine. There was hardly any arthritis, which we confirmed with an MRI scan and an X-ray. So when you have a good knee and a patient who is having active lifestyle, we can't treat them with conservative options, which few of the doctors had given to him before. But considering his 3 ligament injuries out of 4, he was struggling to even walk. He was not even keep his feet onto the ground because the knee was totally wobbly in spite of wearing a knee brace and the kneecap. So the patient wanted to have a permanent solution. So after assessing a complete scenario, considering a good knee, not much of arthritis, and considering his stamina and his endurance and his will to go back to his active lifestyle, all these things made me to take up this case. And also I have published an article similar in line with it, what we call as a ACL reconstruction, that means a ligament surgery in patient who are 50 years and older. I had published this in Indian Journal of Orthopedics around 8 years ago. So we had done around 50 patients who are 50 years and older, and we had done knee ligament surgeries. And that article conclusion was that if the patient selection criteria is good, and if you are able to do a good orthoscopic ACL surgery in them, they are able to go back to their active lifestyle. Some 50-year-old, they are into golfing, they are into badminton, and they all can return back to their sports, but provided that indication criteria is good. Like as I said, the knee should be good. The arthritis should not be progressed into the last stages. A grade 1 or grade 2 arthritis with a complete ligament tear, and the patient having symptoms of instability, that means not feeling stable on the knee, it feels wobbly. In these particular subset of patients, if we treat them with orthoscopic ligaments repair, they all can go back to a good active physical lifestyle.
Can you tell me in short about the surgery? I understand it was really complex. You used graft from multiple areas. So can you tell us a little bit about that? Wasn't there a simpler option?
Yes, that's a valid question. See, when we have a complete ligament tear, then we can't repair it, Shayan. We have to reconstruct it. So how do we reconstruct? By taking a tissue from other part of the body. Most of the times these ACL or ligament injury patients are quite young guys. So we take them from, we take the tissue, what you call as a hamstrings from them. It's a small tendon which comes from the back part of the knee and gets attached to below the knee. So we take that hamstrings, prepare it as a ligament and reconstruct the ACL. That means in the place of the old torn ligament, we will put this new ligament in that place and fix it with the calcium screw. But here the challenge was, it was not just one ligament, it was 3 ligaments. So we needed 3 graft. And one point why most of the doctors hesitate to operate in old people is the tissue quality, the graft quality will be poor. But here the one good advantage was that patient was an active guy. So we assumed that his graft would be strong because he's an active, he's using his bike, he's walking around, he's been living an active lifestyle. So considering that, we took him up for surgery. So the challenge was to take 3 grafts, not just one. So we could take one from his knee, below the knee, that's hamstrings, and one from the ankle, what you call as a peroneus longus. So that's the latest graft that we have started doing nowadays in some ACL surgeries.
Okay.
And another graft was from the other knee, what you call as the hamstrings. So we took these three grafts and we reconstructed all his three ligament which was torn completely. So, and one more thing is that it's always considered that in age the healing is slow, right? That's also another point, that the ligaments may take long time to heal.
Right.
But yes, when the surgery is being done correctly, it's been fixed in a stable way, and if you put them on a proper rehabilitation protocol, they can recover just the same way as a young guy, but provided the knee is good. So considering all these things, we did this arthroscopic ligament surgery. Arthroscopy means it's a keyhole surgery. We do not have to cut open his knee. All the three ligaments were reconstructed using just two keyholes. Using those two keyholes, we could reconstruct all his ligament back, and the patient was able to get back on his feet very next day. But of course, with the help of a walker for 2 to 3 weeks. In 3 weeks, the new ligaments will get healed to a certain extent, and then the patient can come out of the walker. So he was back on his feet without any support in 5th week, and on 12th week he was able to do running and jogging, and by 4th to 5th week, you don't believe, he's back on his bike now. He's going on long road trips now.
This person, how soon after the injury did this person come to you for treatment?
Yes, he reached out to us around 5th or 6th day from the injury.
So let's say the person reaches out much later. Let's say 5 months, 4 months have passed. The person has tried other forms of therapy or whatever.
Yes.
Would surgery still have been an option then?
No, the situation would be little different considering the time frame. Depends on what time frame they come and present to you. Anything within 2 to 3 months from the injury is good time, because the knee wouldn't have been damaged more. See what happens in an untreated case of ligament tears. First, I'll break down to you. If the patient or any athlete or any person with a ligament injury, takes a call that, okay, let's wait and watch, let's not do the treatment. So they will be walking with the frequent instabilities with one ligament. But considering three ligaments, this guy was not able to even keep his feet down on the floor because of the extreme, that unstable feeling there. So what happens is, the patient will start losing the muscle strength. So his quadriceps and the hamstring will start going into weakness. They start going into atrophy. So he'll start losing muscle mass. And also the knee will start becoming weaker because he won't use that leg much. So because of the weakness, the bone quality will get poor, what you call as a disuse osteoporosis. And over a period of time, because of the knee which is losing balance again and again, the bones will start rubbing against each other. So because of that frequent rubbing, they start developing arthritis, which was not existent till now. So an untreated ligament tear always leads to arthritis. But of course, it always happens over a period of time. But considering here 3 ligament, this patient would have developed arthritis in pretty 6 months to 1 year period, because of the 3 ligament tears. So yes, if it not treated in the right time, you would have developed extreme weakness in the muscles, joint arthritis, and poor bone quality.
So this person, I understand, is not only walking again, but he is on his bike again. He's pursuing his passion once again. Can you tell us a little bit about what his recovery or rehab would have looked like, or has looked like for that matter?
Yes. So rehabilitation is the most important part of the surgery. So I always tell my patients, whenever I do my surgery, I always tell them that 50% of the recovery is from my surgery, another 50% is from the rehabilitation. Because see, I'm going to put a new ligament, I'm going to make the knee stable, but that's not going to get his strength back, right? So the strength always comes from the rehabilitation, the physiotherapy. So these kind of patients where we operate 2 or more than 2 ligaments, we always put them on a period of rest with the help of a walker. Of course, we'll make them walk pretty next day, but with the help of a walker support, because we don't want the complete weight to go on that knee, because the new ligament will be still in a healing stage.
Right.
We don't want 100% of weight to go on that and become loose or get retorn again. So 3 weeks of walker support, but the patient will be mobilized. That's the most important part. We have to make the patient walk with the help of walker. After 3 weeks, so slowly we'll wean off from the walker, and we expect them to walk putting full weight in 5th to 6th week period. Post that, our focus is more on strengthening, getting the strength back. So we put them on a strengthening protocol. Strengthening again is a time-taking process. It's a gradual recovery. As the patient does more and more exercises, the strengthening exercises, slowly they'll start gaining strength. And by 3 months, they will get enough confidence to do a basic workout like running, jogging, cycling, and swimming. Post that, we have to focus more on the balancing also, because many times once the ligament gets torn, they lose that proprioception. Proprioception is basically your mind and the joint coordination. Although your eyes are closed, your mind should know in which position the knee is in whatever activities you are doing. So that's what prevents these kind of injuries and also prevents retears after surgeries. So we'll work more on balance and the proprioception after strengthening protocol. By 5th to 6th months, we expect them to get back into all sort of physical activities, whether it's sports or whether it's heavy bike riding, whatever they love to do, we let them get back to all those activities once they satisfy all the criteria by 6th month.
We've gone through the whole story of how, what the injury was, how he reconstructed his knee. So most families, when someone in 70s is advised surgery, they don't go for it. They hesitate, right?
Yeah.
What do you wish most families understand for somebody in the 70s going for knee surgery?
Yes, it's a very common scenario. Even in OPDs, when we a guy with 65 plus comes with a severe knee arthritis, along with the son or the daughter or the wife, when they come and when they show us, when I tell them that yes, it's an advanced arthritis and his day-to-day life is very badly affected and he needs to undergo a knee replacement or any kind of surgery, the first question they ask is that, do they need at this age? That's the first question they ask. But what they fail to consider is, from the patient's point of view, see, every individual wants to be active. They really don't want to depend on themselves or on others, isn't it? So whenever such cases is neglected, they get to eventually start depending on others, and that's a kind of a quite and a mental agony for the patient, because one point of time they're very active, and next day they are on a wheelchair and they have to depend on the family members to do all these things. So that takes a good mental toll on that person.
Right.
So that's what family members should consider, and whether the patient prefers to go back to active lifestyle, that's a choice should be taken by the patient himself, not the family members. Meaning, because of course, I don't blame the family members, they would be thinking from the safety point of view, but what they fail to consider is from the patient's point of view, whether the patient really wishes to go back to an active lifestyle or not, whether he really wishes to fix his knee or whether he really wishes to reconstruct or replace his knee. It has to be his wish. So he needs to take the decision, any family members. And also it's the duty of the family members to explain them. Of course, one should always be mindful about the pros and cons of the procedure, but yes, what they should understand is that most of the conditions of the knee and the any kind of joint arthritis or ligament injuries in any age group, it's all treatable, and we can make sure that they can go back to complete normal life like how they were before the onset of these issues. The one thing I would like to tell the family members is, give it the option to the patient, let them choose, and you explain them the pros and cons, you explain them the advantages and the disadvantages, but it's completely the will of the patient. If they want to go back to active lifestyle, we should help them to go back to active lifestyle, either by physiotherapy or by surgery, whatever the surgeon gives the options to you.
Right.
So yes, every individual is important. Irrespective of what age, every individual has a right to be active. That's my point here.
And every individual should be active, because case in point is the 72-year-old man. The surgery, as you rightly said earlier on in the interview, would have been much difficult if the person was not active. And because the person was active, it, the person is alive. The person is doing pretty well now and is back on his bike, for that matter.
Yeah.
So any last message you want to leave for people, let's say over 50, about the need for joint care before we say bye-bye?
Yes. So yes, I would definitely want to pass on a message to the elder people who are 50 and above. Take care of the joints. Okay. So one should always strengthen the muscles. Keep your muscles strong. Right now, we always see in OPDs and any other in ward or anything, patients, all they say is that they just walk. Walking alone is not enough. Probably if you remember, even our previous interview also said the same thing.
Right.
Walking alone is not enough to take care of the joints. It's a good cardio exercises, but not strengthening. everyone should strengthen their muscles. If they strengthen the muscles, keep the muscles strong, they can continue to being active even in 80s, even in 90s. So maintaining a good muscle strength is very important. You walk, but along with that, parallelly, one should strengthen each muscle group: hip, knee, ankle, shoulder, core, back, abdomen. All these muscles should be maintained. Only then they can continue to being active, and also they can prevent such injuries. They can prevent falls, they can prevent fractures, they can prevent ligament injuries, they can prevent most of the other morbidities because of an inactive lifestyle. So my suggestion is, be active, enjoy what you want to do, get involved in all the physical activities what you love to do. Don't hesitate or don't have a fear that you are old, and if you get into sports or any kind of activities, you might have a fall. One can take care of that, all those things. One should be very careful about when you're doing in physical activities, but most important is be very active and consistently keep doing strengthening exercises, and that's when you can enjoy your life and you can continue to be active even in your later years of life.
All right, Dr. Raghu Nagaraj, thank you so much. Congratulations on that successful surgery. The city is blessed to have you here in the city of Bengaluru, for that matter. And thank you so much once again for taking time out and coming to Fever Studio.
Thank you so much, Shan, and also thank my patient, because his will and his stamina and his desire to go back to the physical activities. That's all these things helped us to take this decision, and that's what helped him to get back to what he wanted to do always. Yeah.
Absolutely. Thank you so much, sir.
Thank you, Shan. Yeah.